Yes, welcome back to the Dr. Lati channel. This is where medicine meets clinical sense. Today we're going to discuss a fascinating but often misunderstood neurological condition, and this is none other than Alice in Wonderland Syndrome. This syndrome is not a psychiatric disorder and it's not a hallucination. Instead, it represents a disturbance in perception where the brain misinterprets size, distance, or body image, while consciousness and insight remain intact. By the end of this session, you should be able to recognize Alice in Wonderland syndrome clinically, understand why it occurs, and know how to approach management safely. So this is our outline. We're gonna look through the introduction, the epidemiology, the pathophysiology, the clinical features, investigations, differential diagnosis, management. Yeah, this is a visual representation. You can see small man, big hand. We're going to understand all this in the next few seconds. Alice in Wonderland Syndrome. It's often abbreviated as AIWS, and it's a neuropsychological condition characterized by perceptual distortions. Patients may feel that parts of their body are unusually large or small, or that objects around them appear closer or farther away than they really are. The key feature is that patients are fully aware that these perceptions are abnormal. Hence, their insight is preserved. Please know that this distinction is very critical because it helps us differentiate Alice in Wonderland syndrome from psychosis. As you can see on this slide, it's often misdiagnosed as a psychiatric illness, but it can be a clue to underlying neurological infectious disease. So this is a condition that you should surely not miss. Talking about the epidemiology and risk factors, who gets this disease? Who gets this condition? Yeah, who gets it? Alice in Wonderland syndrome is most commonly seen in children and adolescents, where in adults it's frequently associated with migraine, mostly migraine with aura. Other associations include epilepsy, especially temporal or parietal lobe epilepsy, viral infections such as Epstein-Barr virus, and rarely structural brain disease. In many cases, Alice in Wonderland syndrome is transient and benign, but it should always prompt us to look for an underlying cause. Yeah, as you can see here, the other common association we have psychoactive drugs, pathophysiology. Here we're talking about why it happens. So the underlying problem in Alice in Wonderland syndrome is not in the eyes or the peripheral nerves. Instead, the problem lies in the cortical areas of the brain responsible for integrating sensory information, particularly the parietal and temporal lobes. In migraine, cortical spreading depression temporarily disrupts these regions, and in epilepsy, abnormal electrical activity interferes with perception. Hence, the sensory input is normal, but the brain interpretation of that input becomes distorted. The key concept here remains sensory input is intact. Perception and interpretation are distorted, which comes back to our point. Insight is preserved. The patient, in simple terms, knows that he has the disease. Now, looking at the cardinal clinical features, patient with Alice in Wonderland syndrome, they have very characteristic symptoms. They may experience micropsia. Micropsia is where objects appear smaller than normal. I think you can see this chair. Another symptom is macropsia, where objects appear larger. You can see the hand of the lady. It's characteristically larger than normal. They may feel that their hands, face, or limbs are abnormally large or small. This phenomenon is known as altered body image. Well, yeah, some patients also report distortion of time, where time feels unusually fast or slow. Importantly, these episodes are episodic. Here I mean they are short-lived and they resolve completely. This is another hallmark of this condition. Where you can see this slide, perceptual distortions may involve where you see ma, just know it's enlarged, my shrunken. So that word body image That first word for that has ma, that means the body parts feel enlarged. Then the second word that has my, that means the body parts feel shrunken. Yeah. Then visual perceptions have micropsia, objects appear smaller. Then macropsia, objects appear larger. Then epilepsy, objects appear closer. Teleopsia, objects appear further away when in actual sense they are close. The other symptom is time perception, and this is where time feels slowed or accelerated. It's a two-way. It's either slowed or it's accelerated. We come back to our cardinal feature. Insight is preserved. So we have a mnemonic here. Remember, it's Alice in Wonderland Syndrome. So A stands for altered body image. L, loss of normal size perception. I, insight is preserved. That's a key. C, cortical dysfunction. The brain is not able to interpret, though it receives signals in a proper way, but the ability to interpret those signals is distorted. Episodic and reversible. It's short-lived, it's very reversible. This takes us to investigations. Investigations should be guided by the clinical context, not only in this syndrome, but always remember, investigations should be guided by clinical context. Stop wasting patients' resources. In many young patients with a clear migraine history, extensive testing is not required. However, electroencephalogram should be considered if seizures are suspected, and MRI of the brain is warranted if there are red flags such as focal neurological deficits, progressive symptoms, or the patient is an adult and it's an onset disease, no history of migraine or epilepsy. Hence, here you'll be prompted to dig out, find out the cause, underlying cause. But often investigations are they are normal. Now this takes us to differential diagnosis. So when you receive a patient with the symptoms explained above, distorted perception, when evaluating patients, we must consider important differentials. These include migraine with aura, temporal lobe epilepsy, delirium if there is an underlying disease, drug intoxication, and acute psychosis. It's possible. Remember, the most important distinguishing feature here is insight. In Alice in Wonderland Syndrome, patients know their perceptions are abnormal. In psychosis, they do not. Management principles: there is no specific treatment for Alice in Wonderland Syndrome itself. So managing here, we are focusing on treating the underlying condition. This may include migraine prophylaxis, anti-epileptic therapy, or treatment of infection. Equally important is reassurance. Explaining the benign and reversible nature of the condition significantly reduces the patient anxiety. This is very key in management of this condition. Reassurance, guys. Reassure the patient. Prognosis is excellent in most cases. Symptoms usually resolve completely, though recurrence can occur, especially in patients with migraine. Persistent or progressive symptoms should always prompt further evaluation. Here in these slides, there are red flags requiring further workup: persistent symptoms, progressive neurological deficits, new onset symptoms in older adults. Every presentation without a case scenario is half a presentation. So let's consider this clinical case. A 14-year-old girl presents with episodes where her hands feel unusually large and the room appears far away. Each episode lasts about 10 minutes and resolves on its own. The history of recurrent headaches consistent with migraine. Her neurological examination is normal and she has no psychiatric symptoms. Okay, the diagnosis is there, you can see it. And this is a typical presentation of Alice in Wonderland syndrome associated with migraine. This brings us to the beginning of the end of this presentation. Yeah, so these are the pearls. As always, insight is preserved, there is no psychosis. If it's an adult, think of a migraine. If they are children, think of an infection. And just know that Alice in Wonderland syndrome is a symptom, it's not a disease. Surprised? Then always rule out epilepsy and structural brain disease if atypical. And we said structural brain disease, do MRI. For epilepsy, electroencephalography. Yep. Alright. Alice in Wonderland syndrome is a striking example of perceptual distortion. without loss of insight. Remember these key points and remember it's not a standalone disease. That's it, guys. I sign out. Once again, don't forget to subscribe to this channel, share this knowledge, make the world a better place to be. Tap that notification button so that when I share the next syndrome, the next exciting condition, you won't miss out. And welcome to the channel where medicine meets clinical sense.